to pause for just a second, because I imagine that there are hundreds, if not thousands, of people out there just like you that have been working in the healthcare system and identified a problem or problems, and are very solution oriented, roll up their sleeves, create a way to solve that problem, for the company that they're working for whoever it is that they're serving, and question the value of that being a real viable business idea, and whether they should take the risk and do something with it or not. Whether it becomes a Post-it story or whether it becomes of, oh man, I had that idea. I could have done, A, B, and C with it. So how did you transition from, this is kind of a side hustle to, maybe I'm onto something here, and in commercializing it and turning it into a viable business?
Yeah. I think what it really came down to, and this has been years ago now, so I'm thinking through it. But I think what really helped is the healthcare organization I'm talking about that I started with. They've got maybe 30 facilities, and so word of mouth was really kind of what kind of spurred things. Where talking to the other hospitals, they were starting to voice to me, "Hey, how can we get it?" Right? Because they heard about these 3 hospitals having it and how it solved their solution. And then they these other hospitals started buying it and says, "Hey, how can we, we'd love to have it. How can we, get our hands on it?" Because ultimately they were either using access databases or spreadsheets trying to track it. And that's kind of where I realized that, okay, it's not just the hospital, these 3 hospitals that had an issue. Everybody has these kind of broken processes throughout the organization. I'm like, we can standardize that. And then I realized even organizations outside of that one also have that same challenge. So, it's just kind of an eye opener.